Human Services Secretary Dr. Scrace says that latest map is showing real progress and expects more counties to open up even more soon. News 13's Brittany Bade got an update from the state's top doc today and explains what this summer might look like.
Well, Dean, some areas of the state are getting ready for what they hope and expect to be a busy tourist season. And right now, people there want to know if there will be a statewide vaccine passport requirement.
Present time, we do not have any kind of a plan for passports. There are some states that are and some states that aren't. And, you know, private businesses are free to impose any kind of restrictions they want to.
Scrace says they are waiting for the feds to take the lead on vaccine passports, but he and Health Secretary Dr. Tracy Collins said the DOH could add a component to their app, which would make it easier for places or businesses in New Mexico to verify that someone has in fact been vaccinated. As of today, 5 New Mexico counties are now majority vaccinated, meaning more than half of eligible people in Guadalupe, Los Alamos, Mora, Cibola, and Rio Arriba counties have at least one shot. The state says overall more than 50% of New Mexicans 16 or older have at least one shot. And every person in phase 1 of the vaccine distribution has received an invitation to schedule an appointment. Statewide, the vaccine is making a difference. For every new case, 92 people get vaccinated. But one place it is really being impactful is long-term care facilities.
Since the beginning of our vaccine rollout, the average number of daily deaths in all long-term care facilities have dropped from nearly 10 deaths a day to less than 1 death per day.
Hotram Lopez says facilities have not seen an increase in cases or any outbreaks at home since they opened up to visitors 2 weeks ago. However, statewide cases are flatlining, even going up a little bit in the metro. That is all happening as Dr. Scrace says more contagious and deadly variants are spreading fast in all of the states bordering New Mexico. Scrace says a great defense against that more contagious and deadly variant is any vaccine. The state is expecting a smaller shipment of vaccines next week, down about 20,000 from this week. Dean?
All right, Brittany, thank you. Now, the reason for the drop in vaccines next week is because of a lack of Johnson & Johnson vaccine. This week, we got nearly 31,000 doses of the J&J vaccine. Next week, the state is only expecting 3,700.